Hello and welcome to episode 6 of Sunderland Mind No Filters podcast. Today we are joined by Wendy, an engagement officer from Healthwatch, and she's going to give us an overview of what Healthwatch do and how they are working to improve health and social care services in and around Sunderland. So this episode we are joined by Wendy from Healthwatch. Hi Wendy.
Hello.
And would you like to tell our listeners what you do and what's your role at Healthwatch?
Yeah, sure. So my name is Wendy Hadlington and I'm an engagement officer for Healthwatch Sunderland. So that means I get out and about in the community and talk to people about their experience of health and social care services, making sure they're good. If they're not good, we can do a bit of work to hopefully make them better, and sharing information about services as well. So really, in a nutshell, that is my role. So it's important to say when we say we Healthwatch Sunderland, that covers Washington and the Coalfield areas as well, because I think sometimes those two areas feel a bit sort of isolated and left out. So we've got 3 core roles as a Healthwatch. So the first one, as I've already mentioned, is to get out and about in the community, find out how health and social care services are working for patients and service users. And then we can do focus bits of work with services that aren't doing very well to hopefully put recommendations in for change to those services. And if services are doing very well, it's important that we celebrate that. So we've got a Star Award, which celebrates good practice, and we are going out over the next couple of weeks to deliver those to 3 pharmacies that have done particularly well.
Wow.
So we've heard really good feedback about these particular pharmacies. We literally go out, say thank you, there's a little certificate, and I just think from the feedback we get, that goes a long way.
Yeah,
you know,
definitely.
They're just over the moon, because quite often services hear the negatives and they don't often hear the positives. And I think particularly at this time when everybody's a bit low after Christmas and services have been working really hard over COVID, I think that's just going to be so nice to be able to celebrate that with them.
Definitely.
So that's part of the work. The other, one of the other things we do is we have an information and signposting service. So you can contact us, so you can phone us, you can text us, look at our website and message us through that, email, get in touch and ask us questions around health and social care services. If we don't know, we can always find the answer. So it might be, you know, that somebody is starting to struggle a little bit at home, they don't know where to turn. If they give us a bit of information, we go off and find out who the right people for them to talk to. It might be, with regards to health, that they haven't had a particularly good experience and they might want to discuss that with somebody and maybe make a complaint. We can put them on the right pathway to complain, or we can give them the information they need to get support to make that complaint. So that's a second thing, our information and signposting service. And quite often when we're out in the community, that service kicks in just by having conversations with people. You know, we'll hear something and think, oh, right, we can signpost them to something within the community. The third thing we do is we get people involved in changes to services. So we're talking about health and social care services there. So anything with an NHS logo on and anything around social care that is funded by the local authority. So that might be a care home place, it might be respite, it might be somebody who has a personal assistant, for example, social services as well, so social workers and things like that. So if there's any changes coming up in services, our job is to get people of Sunderland involved in those changes. So it might be that there's a big consultation happening. We'll make sure that we spread that far and wide. We'll do little workshops with organisations so people get to hear and have a voice around changes. And also, if changes have happened, it's our job to tell the people of Sunderland that those things have happened. So shortly before Christmas, the urgent care centre at Pallion moved into the emergency department at Sunderland Royal Hospital. So before Christmas and shortly after Christmas, when we were engaging with people, we made sure that we mentioned that just in case they needed the service. They would be signposted, you know, if they got to Pallion and they're obviously in the wrong place, somebody will be there to direct them. But it's quite nice to know where you're going before you set off from your front door, really. So There's lots of changes going to happen around health and hospital services as well over the coming years, because our hospital, Sunderland Hospital Trust, merged with South Tyneside Hospital Trust a few years ago now, probably about 3 years ago, because time flies. And changes started to happen straight away, but really it affected people of South Tyneside. Now changes are happening that affect the people of Sunderland.
Yeah.
So it's our role as those changes happen to let people know and to find out if they've used those services. So if they've had to go to South Tyneside Hospital for something, was it okay?
Yeah.
Did they get a good service?
Yes.
Was getting there all right? Could they make the travel arrangements that they needed? So we can then feed that back to the trust. So they know more, because they'll be looking at patient experience, but they'll be able to get that from us as well.
Definitely. And these next coming episodes of the podcast are really focused on letting our listeners know what's in Sunderland, what's around Sunderland, and what services are there to help. Okay. And I think getting Health Watch out there, I didn't know much about it, and also I'm not from Sunderland. So once you know about it, I think it's a really key tool that you can use, and it's a really fab service. And I also think from our standpoint as Mind, physical health impacts mental health so much more, and it's the work together.
It's a crossover, isn't it?
100%.
And looking at the services that we cover, mental health services are part of that.
Yeah.
So, anything you go to at the mental health clinics or the mental health hospitals, so we're talking about the NHS work, so Sunderland Psychological Wellbeing Service, so anything that's run by CNTW.
Yeah.
Anything that has that NHS logo on.
Yes.
We cover. So if anybody has a good or a bad experience with mental health services that they go to, at any of the clinics or anything, they can let us know.
Yeah, and you want to know. We
want to know. So if anything's going really well, brilliant. We can tell them, they can have a star award if things, we're hearing repeatedly that something's doing very well. And if they're not doing very well, tell us. We can feed that back to them. And if we hear from, a few people that things aren't going right, we can do a piece of work with them to get it right for people.
And that's what you need. If it's not working, how do we make it work?
That's right. Just what you were saying as well, about outside of Sunderland, wherever there's a local authority across the country, there's a Health Watch.
Right.
So, if you live in County Durham, there's a Health Watch. Newcastle and Gateshead have Health Watches as well. So if you just Google search, you'll come up with your local Health Watch.
Fab. Because I think as well, what I think, if I hear health or Health Watch, even though I work in mental health, I think physical health.
Yeah.
Because I think it's good to let people know that mental health services are covered under that as well.
They are.
Which is fantastic.
So the thing we're hearing the most, and we're hearing it on the news as well, so it's a national issue, is that people are really struggling to get GP appointments. All right, so whether that's face-to-face or over the telephone, online, people are really struggling to access a GP. And we understand that because of COVID, people have built up these health issues that they may have, and they're just starting to feel confident now to try and access their GP. And that's obviously exasperating things. It's making it worse for GP surgeries. And speaking to GP surgeries, we are hearing that the volume's being turned up massively, and it's very difficult to be able to meet everybody's needs quickly.
Yeah.
So one of the things we have in Sunderland that may be able to help is called the Extended Access Service. And that is seeing a GP or a health professional out of hours. So when I say see a GP, I mean see them or speak to them on the phone.
Yeah.
Have contact in some way. Okay? So if you, for example, ring your GP surgery and you're told you've got to ring at 8 o'clock, you ring them and you're 20th in the queue maybe, and that's not unusual these days. Phone lines get very busy. And by the time you get through, there's no appointments. You could ask, if you feel you can't wait, you could ask to be seen extended access. All right? Now, pre-COVID, those appointments were always there as well for people who work.
Right.
So people who work, who can't get out during the day to access their GP. It may be more difficult to access extended access in that way at the moment because things are very, very busy with very poorly people waiting to see GPs. So your GP receptionist can book you into an extended access appointment or an out-of-hours GP appointment.
Right.
All right? Mm-hmm. They can do that for you. Also, 111 can do that for you.
Right.
So if you ring 111 and they feel you need to see a healthcare professional, they may be able to book you an appointment with your own GP, but also they have those additional appointments for the extended access service. So extended access is after GP's normal working hours. So 6 o'clock in the evening till 8 o'clock at night.
Fab.
And Saturdays, Sundays and bank holidays as well. So if you speak to somebody and they'll say, can you go to your local health centre at 9 o'clock on a Saturday morning, you know, that's right.
Yeah.
Those appointments are available.
Uh-huh.
So they may say, 111 in particular may say, I'll get a healthcare professional to ring you back. Mm-hmm. Because when they first started 111, it was all very call centre led.
Yes.
Now there are clinicians that work within 111.
Wow.
So it could be a pharmacist that rings you back and sorts out your medication. It could be a GP that rings you back. It could be a paramedic. It could be a nurse, you know, and quite often there are things that can be dealt with on the phone and they can then send you a prescription to your local pharmacy to be collected or to be delivered. So it's not all about, you know, the physical seeing a doctor if you don't need to. It's about getting that support that you need at the right time.
Definitely.
Okay.
That's fab.
So that's extended access. It's quite important as well to say, and I'll add, 111 at the moment, I mean, I'm sure if anybody's tried to ring 111, are experiencing like high volumes of calls. So there's long waits on the telephone. So what they're saying is, and what they're asking us to tell people is, to try 111 online.
Oh.
So you go on the 111 website and you can start an online chat. So you can put all of your information online, and then if needed, a healthcare professional will either chat back to you or they will give you a ring.
Fab.
And sort out your support from there. And that is maybe a less frustrating way to get through to 111 at this time when they're just so busy. Yeah. Another thing that we do when we're out and about and share information, and we've done this at a couple of Sunderland Minds groups, is promote the Lions Club message in a bottle. So the Lions Club are a national charity, and they've worked with the ambulance service across the country to put this simple little bottle together, and it's about the size of a tablet bottle. Maybe it's a little bit bigger. All right, so it's white and green, and it has the emergency green cross on the front. It has a green lid that you can pop off, and inside is a form. There's two things inside. There's a form, and the other thing is 2 stickers. So on the form, it gives you the opportunity to write on your personal information. So we're not talking bank details or anything like that. We're talking about information that would be useful if the ambulance service needed to come to you and you couldn't communicate to them the stuff they need to ask, just general information. So it would be your full name, your date of birth. Hopefully they'll have your address because they'll be with you. Your next of kin. So who would you like them to ring for you if you were going into hospital? Yeah. They were taking you out of your home. Any medications that you're on. And this form's quite small. So we always say if people are on numerous medications, to put a copy of their tear-off slip that they get from the GP in there, or to handwrite a list of their meds. Now, really important that you keep that up to date.
Yeah. So
the doctors know when you get to hospital, if they're going to give you a medication, that it's not going to clash with anything that you already take.
Yeah.
All right? So really important that you keep that up to date. Another thing that you've got to keep up to date are your list of allergies. Because the last thing they want to do is, for instance, if you have a water infection and you phone the ambulance, sometimes as we get older and we've got a water infection, we can't really communicate properly.
Wow.
Or we can't understand sometimes what people are saying to us.
Oh, really?
So the last thing they want to do, if you're allergic to, for example, to antibiotics, is give you antibiotics if you're allergic to them and make your situation worse.
Yeah.
So write your allergies on there. That's not just medication allergies, but food allergies as well, because some medications have derivatives of different foods and things in there. So it's important that you write them on. For example, if you're allergic to eggs, write that on. All right, if you're allergic to fish, because fish oil's in quite a lot of stuff, write that on and keep that one up to date.
Oh, I didn't know any of that.
Really important. So the other thing that's on there, which, you know, is close to my heart, is if you've got a pet, write it on this form. If you've got a little dog, the dog's probably going to tell them that it's here. You know, it'll be jumping up at them when they come in, etc. If you've got a little cat, you know, or a hamster or something that's in a cage somewhere, you don't want that left alone while you're in hospital.
Yeah, definitely.
So let them know on this form, you know, I've got a cat, the cat's called such and such, and I would like you to ring my next of kin, or I'd like you to ring my neighbour to look after this pet while I'm on holiday. Might be that you've got nobody to look after your pet, but there are organisations that do that for people when you're in hospital. Okay, so all of that form alongside your medication sheet, allergy sheet as well, if you've got lots of allergies, go in that bottle, lid on, and that bottle goes in the fridge. All right, so not because it needs to be kept cool, but because most people now have a fridge. If you haven't got a fridge, put it in a kitchen cupboard. And always put on the 2 stickers I spoke to at the beginning of having a chat about this bottle. You get 2 stickers, stick one where you've put the bottle. So the outside of your fridge door so it can be seen, the outside of your cupboard door. The other sticker goes on the inside of your front door. So the ambulance service are trained, when they close somebody's front door, they'll be looking for that sticker. So it's like a double whammy. They know they've closed the door. Oh, this person's got a message in the bottle. I'm going to go and have a look in the kitchen and see what I can find. And that information will all be in there. All right?
Fantastic. I love
really
it.
Easy idea, isn't it?
Brilliant.
Dead effective.
Really good.
And this for us has been an amazing engagement tool when we're out and about. I know we've spoken to lots of organisations who've said, you know, how do we get a box? If you want a box of them, you can let Healthwatch Sunderland know, and we have a local volunteer from the Lions Club who helps us out with getting supplies.
Oh, that's fab.
Yeah.
Really good. I know when you came into the women's group and you talked about it, and did you come into our men's group?
I did. I did.
In the women's group, and you gave us all a couple. I actually gave a couple to my family who live alone, or some of my elderly family, because that's something I worry about. Like if like a grandparent was to fall or anything, and you know, even if they couldn't ring an ambulance or they eventually got there, what would they know about them, especially if they've had health problems? So it's just fantastic, and having it on the inside of the front door is just instantly, when the paramedics when the paramedics get there, they'll know instantly just to look for it. It's just fab, and especially the bit about the pet.
I know. I would hate to think, you know, my little cat was left alone, and you know, for a week maybe, or even longer.
Exactly. If you're in hospital and you don't know how long you're going to be in there for.
Imagine waiting up in your hospital bed and somebody tells you you've been there for a few days, and you know your cat's at home by itself. Horrific.
My little dog would be eating the furniture.
I know. It's a horrible thought.
But no, that's a fantastic, really, really, really genius invention.
It is. Once a year, so normally at the beginning of April, we put out to the public what matters to you around health and social care, what's important. So last year, people said domiciliary care, so that's care in your own home, young people.
Wow.
And the third thing was carers and the impact of COVID. All right, so we've set up a youth watch, and we've got some new volunteers who are working with us, and that is now up and running. We have had to put domiciliary care on hold, because we're going to be working in partnership with a local authority to do that piece of work.
Fab.
Because as a health watch, in normal times, without COVID, we can't go into people's homes. All right, so it's very difficult for us to be able to access those people who have care in their own home. So the local authority also want to do a piece of evaluation work around domiciliary care, so we're going to be doing that work together. So with COVID being the way it has been this year, it hasn't made sense to do it yet. So that will roll over onto next year's work plan. So the piece of work that we've started now is carers and the impact of COVID. And we've started to do a survey. I've started to do little bits of research with different organisations, etc. But what's come out of it so far is that we need to find out, have services changed that you've used, health and care services over COVID? Have they changed, and have they changed for the worse, or have they changed for the better? The big thing is we need to know from people, how would you see services working in the future to best support you as a carer with regards to your health and social care services. So we're working on a very short survey which should be coming out soon, that we'll be asking those simple questions to people. You know, what matters most to you and how can services support you best? Basically.
Fantastic. I just think it's fab. Like, you guys, you want to know, you want the answers. I think a lot of times, especially over the past couple of years, we've been bogged down with the negative things, and obviously wait times are massive and things like that, but you guys want to know how to fix things, and you take that and practically do it. So it's not as if it's just your answers are going into nowhere. You're being listened to.
And that would be the worst thing for us if we were going out and getting loads of people's feedback and then doing nothing with it.
Exactly.
So we've got strong relationships in the Hospital Trust, in the CCG, so the Clinical Commissioning Group, who commission services like GP surgeries and things like that. So if we hear something, we pass it on.
Yeah.
You know, we've got an arrangement with the hospital now where if we get a piece of feedback, you know, that is particularly good or not so good, we make sure that we feed that back. You know, we might ask somebody who's told us that if we can do a little case study. Would you mind? We'll do a case study. If you would like to speak to the hospital, you know, we can arrange that, because there's different meetings within the hospital where people can actually talk about their stories and how it's been for them.
Fantastic.
I think a really good example of that is within the BAME community in Sunderland during COVID. Any people who went into hospital who couldn't speak English as a first language were struggling with communication. I said any people, a lot of people were struggling with communication. We heard, particularly within the Bangladesh community, so if an older person who doesn't really speak a lot of English or might speak no English at all, go into hospital and it's not COVID times, their family are there twice a day to be able to communicate on their behalf. So, you know, staff might communicate to the family members, that's then passed on to the patient and vice versa. So what we were hearing is, because of COVID and families couldn't go in to visit, that communication sometimes was falling down. And the hospital are quite good at getting interpreters to speak, you know, with people when they've got consultations with consultants, you know, when they're coming round. That can be arranged and that's no problem. The hospital do that. But for simple things like needing to go to the toilet, you're going for an emergency scan, that was a real gap. So we'd heard stories about, you know, one lady in particular who was quite elderly and quite frightened, couldn't speak English, and was taken off the ward for a scan, and she didn't know why she was going or where she was going. So we got the communities together, so the Hospital Trust and representatives from the Bangladesh National Centre. We got them in a virtual meeting, we got them talking, and we had a few of those meetings, and the end result was an action plan that the hospital are working with the Bangladeshi Centre to go through. You know, simple things like picture cards, you know, like of a toilet, I need to go to the toilet. So that can be communicated, or you're going for a scan, you know, a picture of a scanner or an x-ray machine. And equality and diversity training. So from those meetings, the staff at the hospital are getting equality and diversity training.
Amazing.
The staff at the Bangladeshi Centre are supporting the trust with information about halal food, because that was an issue as well, because people weren't visiting, they weren't able to take the food in that the families needed. So just really important that we get that feedback, so we can start those conversations.
And I think that's such a recent, real example of a problem that you've heard, the person's been listened to, and something's been done about it. And I just think if anybody has an issue or good a good thing or a bad thing. You know, Health Watch are there to listen and things can be done, and I just think it's fantastic, because a lot of the time I think people feel like they're saying all of this and nothing gets done, or they've got nowhere to direct their feedback.
That's right, and that would be our worst nightmare.
Exactly.
If we were taking a whole load of feedback, nothing was happening, and you know what, the services want to hear.
Exactly.
If they're not doing it right, they want to hear.
Thank you so much, Wendy, for joining us on this episode of the podcast. I think it's been really informative and a really, really good episode, and it's great to let the people of Sunderland know what's out there as regards to their health.
No problem. Thank you very much. Just I can add, if anybody wants to find out more about us, they can go to healthwatchsunderland.com, or if they need to contact us, they can give us a ring on 0191 514 7145. We'll have lots of ways people can get in touch. So from our website, if you go to the contact us page, people can text, email, or they can do a form through the website as well. Thank you.
Thank you for listening to this episode of Sunderland Mind No Filter. Find us on Facebook at Mind Sunderland or at www.sunderlandmind.co.uk. As well, you can find us on Instagram, YouTube and Twitter at Sunderland Mind. And don't forget to like and share this episode of the podcast. See you next time.